Okay, Mai-Lynne,
Hi.
how are you? I'm going
good.
to ask you a little bit about your research project, so maybe you can start with the project name.
Okay, well, it's kind of a doozy. The name of our project was Long-Term Treatment with Dopamine D3 Receptor Agonist Induces a Behavioral Switch That Can Be Rescued by Blocking the Dopamine D1 Receptor.
Wow, that is a long title.
Yes.
So tell me about the project and give me a little description of it.
So primarily here in our lab, we focus on RLS, which is Restless Leg Syndrome, and it's commonly treated in the clinic with D3 receptor agonists.
Okay.
So these are drugs that target your D3 receptor, which usually mediate inhibitory responses. Because as with restless legs, it's like having the constant urge to move one's legs, especially at night.
Okay.
So for this project, we created an animal model that kind of mimics what we see in the clinic. So we took a group of mice and we injected them long-term with the dopamine 3 receptor agonist as they would do in the clinic. What happens in the clinic setting is after receiving this treatment chronically is we notice what is called augmentation. So what is usually a very effective treatment over time loses its effectiveness and can even result in the worsening of symptoms. We were able to mimic this in our mice by treating them for a course of 4 weeks, and at the end of the 4 weeks we noticed a great drop in their latency times, which exhibits that the drug was not being as effective.
Right.
So here we have this animal model, and the next thing we wanted to look at was how could we prevent this from happening or rescue it. So then we took a D1 antagonist, and what the D1 receptor does, it controls like excitatory responses, and the antagonist would block this receptor. So we took these chronically treated animals that received the D3 agonist, and we gave them an injection of the D1 antagonist, and what we noticed was a rescue effect. So these animals that were exhibiting, increased movement, increased sensitivity, we gave them a shot of this D1 antagonist, and there it was. Their latency times were back to normal as when they first started the D3 treatment.
Wonderful. So that's a good, gives implications for maybe treatment for humans with the same disease, correct?
Yes, we're hoping to use this as a launch pad to start looking deeper into more so the mechanisms and also how we can provide more effective treatments.
It's wonderful. Well, before you started this research, what were you most afraid of?
I think everyone's afraid of failing, but the thing is you can't really fail in research. You kind of just learn what doesn't work, and even that's very helpful.
Right, very good. So tell me about some of the skills and the experiences that you gained.
I gained a lot of skills. One of them is being able to effectively communicate what we're trying to do. We tend to use a lot of words that are not easily understandable, so learning how to relay what we're trying to do in a way that everyone can understand became a skill. And then you just learn a multitude of techniques that you need to carry out the experiments, such as animal handling and drug calculations.
Very good. And finally, what did you find out while you're doing this research that you didn't expect?
I didn't expect it to go so smooth. Usually when we do research, at least 3 things go wrong, and this project actually went really smooth. It showed that you can have a successful project start to finish with no hiccups.
That's
so that
wonderful.
was nice.
Yeah, that's really rewarding. Well, thank you very much.
Thank you.